Welcome back, everyone, to OpenLine. We are talking about a plan that would transform healthcare here in Nashville. It's a plan to treat the city's poorest patients. It would really change the way that is done. We have with us Dr. James Hildreth. He is president of Meharry Medical College. We've talked about that a little bit here off the top. I'm just going to go to the phones now. Let's go to Mike. Hello, Mike.
Yes.
Go right ahead.
Yes, I'd like to compliment your program for addressing this much-needed problem. We all know that we have indigent, and we have always had indigent citizens, and we'll continue to have indigent citizens. However, just based on what our president has stated about these proposed services, I'm really kind of in a state of shock, because when we talk about who is indigent and what indigent care would extend to, raises some real questions. For instance, he stated that a person could be employed, have insurance, and still be indigent. We're talking about a medical delivery program that would literally put Meharry and General Hospital in the business of negotiating with all of the healthcare providers in Nashville with monies provided by the city, the state, and the federal government. And all of a sudden what we have here is not $150 million a year, but an unlimited number of millions of dollars based on negotiations among these healthcare providers. We ought to take a close look at this, because the citizens of Nashville are going to have to pay for this. And what it is, it's socialized medicine. It is unequivocally a healthcare system provided toward a certain group of society which will not pay for this. Everybody's going to have to pay for it. And it's a grand plan, there's no doubt about it. Please, let's stop and think about the step that you are proposing that we take. Thank you very much for my time.
Mike, thank you. Thanks for that. You hear what he said there?
Sure.
What do you say?
First of all, let me set the larger context, which is that the total amount of money spent on healthcare in the United States of America is $3.5 trillion. That's $10,000 for every person who lives in our country. And if you just take the amount that we spend on healthcare, the $3.5 trillion, and set that up as an economy to itself, it's the 5th largest economy on the planet. So we're spending a vast amount of money for healthcare in this country, and yet compared to some other countries that spend less, Americans generally are less healthy. So the point is that we're already spending a lot of money on healthcare, and we know from a lot of research that healthcare only accounts for 10% of our health. Our genes contribute 30%, our individual behaviors contribute 40%, and then there's the social determinants of health. Do you have a job? Where do you live? What is your age? Do you smoke? These kinds of things. So the point is that we're spending a lot of money to keep people healthy, but it's not seeming to do what we want it to do in terms of making people healthy. We're not proposing that Nashville General and Meharry Medical College negotiate on behalf of the citizens of Nashville a healthcare plan or system. What we're proposing is, let's take the existing resources that are there and make sure that we're making the best use of them by taking advantage of the fact that Nashville is set apart from almost every other city in the country in terms of healthcare resources. We got 3 of the best hospital systems in the country, Vanderbilt, HCA, and St. Thomas. They already do an enormous amount of indigent care. They have services that are really the best in the country, some of them. And we have a Safety Net Hospital that does a great job of taking care of those who cannot pay. And then we have Meharry Medical College, which for 142 years has been committed to taking care of people who cannot pay. So we're not suggesting that we're going to negotiate on behalf of the city. What we're proposing is, let's take the existing resources and make sure we're making the best use of them. And if we do this correctly, to the caller, the cost of doing so should go down, because we're going to make sure we're doing these things in the best possible setting.
That would be the determining factor as to whether this is a success.
Correct.
What brought this on was Mayor Berry saying we are going to shut down Nashville General.
Right.
In other words, the city can no longer afford to subsidize Nashville General.
Right.
Is it $25 million? Something like that.
It ranges from $45 million to I think about $55 million.
Oh, okay. 45 to 55 million. So it would seem like for this to be successful in the eyes of it should be less than that.
Sure.
Our subsidy should go down.
But I also want to remind the viewers and the callers that that's only a small proportion of the total operating budget of the hospital. They do have programs and initiatives that generate revenue beside that they're getting from the city. So it's really important for people to understand that that's a proportion of the operating budget, but they're providing services, some of which pay for themselves. So it's not like that's the only thing that's available to the hospital. I think the team there does a good job of managing with the resources from the city, plus all the other things that they do.
So if you're somebody who's focused on that $45 to $55 million subsidy, when do you think, if this plan goes well, the city would no longer be contributing that kind of money?
I can't really say that because there are a lot of things that need to happen between now and when this plan would be implemented. There needs to be a gap analysis of where resources are needed to be redirected or placed. We need to understand, are we making the best use of advanced mid-level providers, nurse practitioners, physician assistants. We need to make sure that people are getting into primary care providers to make sure we do preventive things that will keep them from getting sick in the first place. So over time, as these things get put in place, we should see the cost of caring for these individuals at least be stabilized and certainly go down, hopefully go down, but certainly not go up.
Because that has been difficult for the council and for mayors.
Yes.
The subsidy to Metro General does keep going up.
Yes.
And you're saying this is a way to stabilize it, hopefully lower it.
Right.
So the last caller threw out those words, socialized medicine. And you hear that, what do you say?
Well, I personally believe that health and healthcare is something that all of us are entitled to. And as I said before, it seems to me it's disturbing that we're spending the equivalent of the 5th largest economy on the planet for healthcare, and yet in a lot of ways we're not as healthy as countries where people are spending a lot less. A lot of it has to do with our built environment. In other words, it's hard for people to walk to their jobs or walk to their shopping activities, so we need more. I mean, there are a lot of things that contribute to that, but I do believe that we need to find a way to reduce the cost of health care for the citizens of the United States, because some of those $3.5 trillion could be best used for other things: education, teacher salaries, tuitions for people who want to go to college or university. So I don't think we should have a socialized system of medicine, but we got to find a way to bring the cost under control so we can use our resources for other things that are much needed, especially if we're going to spend all that money and not be as healthy as some countries that spend less.
All right, let's go to Jamal. Hello, Jamal. Jamal, are you there?
Hello.
Hello, go right ahead. What's on your mind?
I was watching your show on Metro. I mean, it's a wonderful hospital. I've actually sent people there who've had bad dental problems who couldn't afford to go to a regular dentist. And I mean, it's an asset to the community because it really supports, I mean, an idea that you can't afford something, but you work and you do donate money and you help supply money into the economy. And I mean, getting rid of it would only hurt the city more, and we're losing so many things in Nashville through all this expansive growth, from housing to everything else. Healthcare is something that we really need to keep for our citizens. And so, I mean, the expense of losing a diamond, a true diamond in the rough, like the Metro General and just that area, what would you do if you got rid of it? Tear it down and build another condo? We need more health care than we need another set of apartments for, the city. So, I mean, that's all I really have to say.
Okay, thank you. So Jamal talking about just how important this is.
Sure.
And he doesn't want to see it go away.
Sure.
And that's what brought this on, was the concern that it might go away.
Right, and you know, people have probably read the stories and heard the stories about rural hospitals closing almost on a daily basis, because it's hard sometimes to make the financial models in hospitals work because there are fixed costs. For example, hospitals require staff to have to be there continually. So whether you have 10 patients in your hospital or 100, there are certain costs you have to be willing to, you have to meet those costs. And so that's why so many hospitals are closing, because the margins are razor thin in some cases. And if you don't have the volume of patients to support that, you know, you have no choice but to close those facilities. So there's a lot of concern about rural communities, how will they get their health care. So this is a national problem. It just doesn't affect Nashville, but certainly in rural communities all over the country, this is a concern that's having to be dealt with. And I think, as I said earlier, Nashville is blessed to have one of the richest healthcare ecosystems in the country, and we should be able to figure this out.
Right. Let's go to Wayne. Hello, Wayne.
Yeah, good evening. How you doing tonight?
Doing well. What's on your mind?
Yeah, the question I have is this. I think the integrated system is a good idea, but I grew up in Nashville, and I remember the old General Hospital when it was on Hermitage. And, of course, the patients that would come in and out of there, you know, we didn't call them indigent, we called them poor. Mm-hmm. Well, now that it's been rebuilt next to Meharry Hospital, I think Meharry is dependent on it. But my question is this. Anytime you're innovative, it takes a year before regulation to catch up. And the problem I have is, how are you going to control the number of repeaters that use this hospital as a roost? I mean, they basically come in for any kind of medical emergency just so they can have a place to stay. And my fear is that homeless are basically going to take advantage of this. So how are you going to regulate the repeat offenders?
Okay. All right. Thank you.
Well, I think the caller is absolutely right that many people use emergency departments as their sole source of health care. And one of our goals in developing this plan is to make sure that people can be connected to providers in a setting other than emergency departments, because it costs so much to take care of them there. And in some settings, in some cities in this country, hospital systems have actually built or rented apartments for the homeless people because of what the caller just said. It's cheaper for them to find them a place to stay than it is to keep seeing them in their emergency department.
That's amazing.
It is amazing. I mean, that just illustrates the extent to which people are trying to find ways to control costs, that there are some hospital systems that have gone as far as to build or rent or, you know, lease apartments for the homeless individuals who come routinely to their emergency room because it saves them money. And so I wouldn't call them repeat offenders. These are individuals who are making use of the healthcare system in the only way they know how. They know if they come to the emergency room, they have to be taken care of. As I said to earlier, you cannot, if you receive any support from Medicare system, you can't turn anybody away. If there's an emergency condition, you have to at least stabilize them before you send them on to another facility. So one of the whole goals of this proposal, let's find a way to take care of whoever comes to us in the best possible setting, and we're going to have some eligibility requirements. What is your income? Do you have insurance or no? And we're going to have a uniform system whereby we can track people and make sure they're going to the right settings. And one of our aspects of our proposal is to have care managers. These are individuals who are going to make sure that we stay in touch with people, stay on top of them to make sure they're going to and taking care of what needs to be taken care of. Because again, when people present to medicine in the late stages of some diseases, it's much more expensive to take care of them if we had not identified them early on in their condition.
All right, we're going to take a break. If you're on the line, hold on. If you want to call in, there's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.